just by way of introduction, I'm David Fleck, the founder and managing partner of Freeflow Ventures, and super excited today to have Andrea with us. She's the founder of Holoclara, a super interesting company that basically had a, and this is the way I describe it is like only at Caltech does something like this happen, at least in my mind, where, or in places like Caltech, where she had this insight and this curiosity around and this eventual discovery of the fact that uh, places in the world where gut worms were present had lower instances of basically certain types of immune problems, and then in other areas of the world, more industrialized places, like the United States, et cetera, where that was not the case, higher instances of immune problems, and started just kind of poke and prod at that problem or at that discovery, and come to find out that through their discovery engine, and I'll let her walk through what that looks like, what that process is. They have now figured out that there are actually therapeutics that can be developed using these worms. So it's just a really interesting application of curiosity meets science, meets a little bit of an unorthodox, if you will, approach that has seems to have like real promise for solving some of these more intractable problems. So with that, we'll pass the mic over to you to just provide an introduction to the company, and then I'll rejoin, after you can conclude that, and just start to ask some questions. And I'll just remind the people that are there in what we call the studio audience that you can always ask questions using the chat feature, and we'll get to those questions as well. So with that, I will pass it over to you. And thanks again, everybody, for taking time. And Andrea, thanks for taking time out of your busy day. I know you got lots to do, so appreciate it.
For sure. Thank you so much for having me. I'm very happy to be here, and it's great to work with you all at Freeflow. So I'm just happy to also just introduce myself. My name is Andrea Choe, and I'm the CEO and one of the co-founders of Holoclara. And I put together a couple of slides, so let me pull that up. I can walk you through our story. Okay, so our vision at Holoclara is to provide relief for millions of people with debilitating diseases using worms, as David has introduced. And I guess I really wanted to start with this concept of what are these allergic and autoimmune diseases, and where are they? And we know that millions of people have them. I mean, just amongst the audience, I can't see you, but if I asked you to raise your hand, do you know anyone with an allergic and autoimmune disease? You would for sure see hands go up. We all know someone that's afflicted with asthma or IBD or lupus or MS. These are just a couple to start with, but there are hundreds of allergic and autoimmune diseases. So interestingly, if you look at areas of the world and ask, what countries have the lowest incidence of allergic and autoimmune disease? Sub-Saharan Africa comes up. And did you also know, if you ask what areas of the world have the highest incidence of gut roundworms, Sub-Saharan Africa also comes up. So that is super interesting, because why is that? Is there something protective about gut-dwelling roundworms? And actually, if you do look at, you can see within specific diseases, and I'll just go back actually for a second. This is areas of the world with a specific species of roundworm, and these are areas of the world that in the incidence of Crohn's disease. So you can see that when you merge them, it's almost mutually exclusive. So why is that? And the idea is really that gut roundworms have co-evolved with humans over many millennia, starting back from, if you remember Lucy from the grasslands of, Africa as an Australopithecus, from these many millions of years ago, worms have had the opportunity to co-evolve with our human ancestors all the way to modern man. So they've really had the luxury of time. And I just want you to just conceive of that millions of years ago. Usually when I ask people, what is the last historical date that you can remember in your mind's eye, it kind of goes back to, I don't know, World War I or, you know, the Egyptians, if you could name that date. But then if you just think about the scale here, we're talking millions of years. And so that is a lot of time for worms to have iterated and created and evolved a technology that benefited both themselves and their host. So in that way, these gut worms, it's in their best interest to promote wound healing. You want your home to be happy, not hemorrhaging. So if there's a wound, it would be in your best interest to repair that. It's like having a hole in your home. You want to, make sure that you're not just putting, some spackle over it, but that you want to lure in the cells, it's to actually repair that hole. And they can also block inflammation. So, these cells, the cells of your immune system, are really there to make sure to defend you against pathogens. But sometimes there are no pathogens and they can cause more harm than good. It's almost like, the police coming into your home and shooting bazookas everywhere and creating those holes in your home. And you're like, wait, hold on a second. That's making things worse. So the worms, it's in their best interest to also dampen that inflammatory response. And also think about it. You want to make sure that they're not coming after you. So it's in your best interest, if you're a worm, to almost have a technology that says there's nothing to see here. And interestingly, they can also block obesity. There are preclinical studies to show that they do. And if you think about it, it makes sense that you want to help regulate the source of energy and resources and nutrient consumption that your host is using. You want to stock the fridge with food and then eat the food and clear it out. You want there to be a healthy cycle and a turnover. You don't want to just stock the pantry full of food and then there be this dysregulation. And they can also stimulate stem cells. So here on the left is a simple diagram of what happens to our intestines over time. You can see that in our youth, we have these villi, intestinal villi, and they are close together. But as we age, they start to sparse out. And, over time, it just becomes harder to digest food. You get more bowel issues, some microbiome issues, just due to the local landscape and geography of your intestine. And there are studies to show that, worms are secreting things that can actually increase the number of stem cells in the intestinal crypts and turn on almost fetal programming all over again. So here's an example of all of the things that worms have been proven to do. These are all papers where you can see worms. Here's the worm in green and here in red are some of those fetal genes that have been turned on, like I said. And here's a mouse that was given worms, and here's with no worms, you can see that it prevented obesity when they were given fed a high-fat diet. They're able to block atherosclerosis, rheumatoid arthritis. Here's a paw that has arthritis, and the paw of a worm I keep calling them worms. The paw of a mouse that has worms, you can see it does not have that same phenotype. Here's our paper showing worms. When given worms, the lungs of mice are restored to their natural state. And you can see that in the lungs, there's all of these inflammatory cells between the alveoli and the bronchi. So normally when you breathe oxygen down your bronchial tubes, you want there to be some nice space so that oxygen can diffuse into the capillary beds around it so that your blood can deliver oxygen to your body. And then a human trial where humans that have ulcerative colitis that were given worms actually experienced remission. So there's all of this preclinical data, right? This has been going on for decades. So why is it that anyone hasn't advanced worm-derived molecules into the clinic? And I don't really know the answer to that, except that's what we're doing. So we mine and develop novel therapeutics from worms, and we're the first to mine worm-derived small molecules in patent-protected first-in-class chemistry-driven programs for FDA approval. And if I had to take a shot at why now, right? Why is it at this point that we're able to harness this technology? One way to look at it is just to understand the universe of molecules in general. Like if you think about biological molecules, there are DNA, which there are 4 letters of that alphabet over here. And there's the same thing, 4 letters of the alphabet for RNA. And then the proteome, they're made up of 500 amino acids. So I just want you to think about that. For every living creature in the whole world, plants, animals, whales, fungi, whatever, they are all using this very finite system of 4 DNA, 4 RNA, and 500 amino acids. So it's been very easy for the last couple of decades when you have something to analyze it and say, is it this or is it that? Is it G or A? Is it glycine? Is it valine, right? It's been easy to elucidate things that live. What is it in the DNA, RNA, or proteome? But the metabolome, which are things that are secreted in the chemical space that can take on any sort of isomer or 3-dimensional structure, chains, this is really infinite space. In fact, some people call this the dark matter, like the parts of the universe that can't be seen. And I think that over the last 5-10 years, there's been an incredible advancement in the technology of mining the metabolome. And so here is a representation of what I just said. If you look at the universe of molecules, here in red, if you just imagine each plus sign as molecule, those that are the DNA and the RNA and the proteins have really been mapped, but those that have not yet been mapped in the metabolome, this is only recently been unlocked and is the next frontier for drug development. And so that's what we're doing at Holoclara, is we're taking the unmapped metabolome and identifying which key molecules here can we use that can help us with inflammatory disease, that can help with anti-aging, regenerative medicine, and metabolic health. And I'm excited to share that, with our lead molecule, we're entering our first clinical trials this year. And I'll stop there and take any questions.
I will rejoin you now. That was awesome. So a question that I always have, just to context set for everybody, is because I'm always curious about this. I know we've talked about this, but you're on this path, getting your various credentials that you have, right? And so why did you choose to actually start a company? Why did you choose the entrepreneurial path? What was it about this that you said, you know what? This is what I want to dedicate my life to?
No, I didn't. I didn't want to. I was on my MD PhD track. I don't know if you know anyone in the MD PhD program, you really are committed to many decades of education to get there. So when this happened, I naturally thought that I think I just simply didn't understand what would happen. I kind of handed it to Caltech. I was like, okay, what's going to happen to it? And I didn't get a response that was satisfactory, right? It's not that there's like a lineup of CEOs waiting to take on projects.
Yeah.
And so I just had to do it. I think that this can truly possibly turn the tides of allergic and autoimmune disease. So I don't really want to be on my deathbed and not know the answer. I just have to know.
Yeah.
I
So
didn't have a choice.
gotcha. Yeah, because you wanted to have an impact.
Of course.
Yeah. Yeah. Well, I mean, that's I call it the get out of bed in the morning insurance. It's the stuff that even because with any startup, there's tough times, right? So it's that, all right, I'm getting out of bed this morning because I'm working on, even though I'm dealing with all this other stuff, I'm working on something super important.
It's that, and I surround myself with people that are very passionate and also really care about, making an impact. I think that, you know that amongst the people that I've collaborated with and our advisors, and we also have, I think I see Brian and the attendees here, Brian Stoltz,
Yeah.
just having a group of highly motivated, intelligent thinkers around you is really the key to also continuing to be motivated.
Mm-hmm. Yeah. Yeah. Um, what you alluded to this in the presentation. I think you call it the discovery engine. Can you just maybe walk through, because I know that this could potentially be applied to many different things. So how are you prioritizing stuff? How is that discovery engine? How does it work? Is it, are you using, how much how much of that is maybe dependent upon what I'll call the wet lab versus in silico, if you will, like, doing stuff via, machine learning and compute versus kind of going to the lab, like just maybe walk us through that whole dynamic.
I think at this point in time, one can't afford to utilize all of those things, a wet
Mm-hmm.
lab and computational biology. But I'll start from the very top of this, which is how are we picking our worms,
Mm-hmm.
right? Because it could be anything, it could be any symbiont. And, we take stock of all things, but truly, I think that there's something here that hasn't yet been explored with specifically worms.
Mm-hmm.
There's tons of evidence here. So I think that we have those worm species that we already know are therapeutic. Like I've shown you now papers and pictures from papers, right? Those are all, they're not, there's no mystery about them. There's something happening there that's been peer reviewed and even put in humans, right? So
Yeah.
I think that we want to start with that. I wouldn't necessarily call it low hanging fruit because it's also complicated to try to take those worms and harness things from them. However,
Mm-hmm.
I think that they're the most important worms to start with. So we always start with the ones that we feel like would make the greatest impact. And then we find a way to then pull in the best chemists and metabolomics experts to figure out what it is that they're making. And then so from there, there is all of your traditional drug development tools, preclinical models, animal models of disease, in vitro modeling. Then there's computational biology. Then there's, working with, I see some questions in the chats that says who do you collaborate with that's in the free flow
Mm-hmm.
startup space, Imu, right? Tatiana and David. So,
Yeah.
there is a lot of room to blend all of these very agnostic approaches that allow you to do a screen blended with animal models and in vitro models. And then from there, you march forward the compounds that are the most therapeutic and also make the most sense to be the therapeutic um, candidate for a number of reasons. Is it druggable, right? So if it's something that's made by the worms, but it's elusive, poof, it's gone. It's not, you can't move that forward. So I just
Mm-hmm.
think that there's a whole 360 approach to identifying and then moving forward molecules. But again, we also have chemistry as our North Star here, so we can make things from scratch. And therefore, we have the luxury of testing it in many different environments without having to deal with, at this point, proteins and things that have batch to batch differences, et cetera.
Yeah. Yeah. Um, to that point, Mike's asked a couple questions here. And you mentioned IMU. Just how are you working with other companies to maybe accelerate? Because at this stage, it's interesting because startups have to be super scrappy, test new things. Like, how are you pushing the envelope and perhaps by working with other startups, you mentioned Imu, I don't know if you've done anything with Sarkis at Nuance, but either way, autoimmune is a huge problem. And as someone who has some of the autoimmune issues, I think it's a really, obviously selfishly, but it's a really important problem to go after. But how are you thinking about that as you think about growing the company, just in terms of, yeah.
Yeah, I think that one is I really believe in building our technology and having our core technology and building everything in-house. I think that I do love collaborating. Like I said, I did do a study with Imu, and I have yet to do one with Nuance. Is that Brian's?
Yeah,
Okay,
Brian
yeah. Well,
Focus.
I'm set to have dinner with Brian in a couple of weeks, so maybe I will ask.
Yeah.
But I think that I really believe in building our own core technology. There is nothing like my head of people called it the war room the other day, right? There's nothing like getting around the table and having everyone there live react to fresh data, moment to moment. How do we interpret this? How do we change today? I think when you start to collaborate, it's great for bringing in new thoughts and fresh ways of doing things. But ultimately, at the end of the day, I really believe in building all the technology here in-house.
Yeah. Yeah. Gotcha. Yeah. And that's, and for those who don't know, your funding has changed over the last year. You raised your Series A, so that's a different, that's a milestone. But congratulations in this environment in particular. It's like a badge of honor to reach that milestone, so you can start to make some of those investments that I know we've talked about for a while. And Mike's second question, and I'll just read this one for the audience, but is there a direct cause effect worm autoimmune disease versus coincidence or DNA direct related like sickle cell, which have also geographic race predilections to use CRISPR, um, and capable of clearly defining sequence errors? So any comments on that line of
I'm
questioning?
not sure that I fully understand that question. Can people actually ask questions live, or is it you're reading off of here?
I'm reading off of here. Yeah, there's
Okay.
not a way to do
Can you
questions.
just make everyone the host? No, I'm just kidding.
um, well, either way, maybe Mike,
Well,
if
the
you.
data that I shared with you on the map is epidemiologic, right? So within there, you always have to, and that's correlative. That's not causative. So
Yep.
I'm showing you what potential is there. Is it a coincidence that areas of the world that have gut roundworms also have the lowest incidence of autoimmune disease, allergic and autoimmune disease? But there's also other things going on too, right? We're also taking antibiotics. The microbiome has been impacted. There's more plastics, right? And so, you just pick all those apart and you think about them logically. We've tried putting back probiotics for over 50 years. What impact has there been? We're still increasing the incidence of these diseases. What else could there be?
Mhm.
Right. So
Yeah.
I think that then we go into the preclinical studies where they reintroduce worms into disease models and it can block those diseases. So that's directly causative in that it can create that therapeutic effect.
Yeah.
So, with any technology, you're putting together pieces of the puzzle.
Mm-hmm. Yeah. Yeah. I think that goes to Suds is the next question I'll get to. And Suds is a founder of a company. So I appreciate his line of questioning because he's kind of getting at that, what you were just referencing, which is basically, and I can read parts of it, but just basically how do you navigate picking the targets and then divvying up the resources, knowing that you're a startup, right? So how do you, and was it the first one was your initial hypothesis correct? Or were you surprised along the way and you're like, oh my gosh, like we thought we were going in this direction and now we need to go in this direction because the data is leading us there, you know?
It's the data and it's the market, right? There is also, you have to be very aware of what the market is looking for. There was a time when there was
Mhm.
more platform and there was a time where there's more asset driven. Now we know that the market is asking for clinical data. And
Yeah.
so in that way, you really do have to push forward and put more resources into your clinical candidate. However, I'm not a person that's very all or none, right? So even when we have to shift priorities, we never kill a program. We never pull all resources away from it. And also, that's the beauty of a startup team. All people are working on all projects. It's not like I have to fire half the company to focus on one project. Where that's also why I like having all the technology in house, because like I said, we gather around. I shouldn't call it the war room. I don't, is that a Dr. Strangelove reference? It was just the idea of like people being very passionate around the table, and we can collectively make these decisions and move quickly.
Yeah. Yeah.
Yeah, it's hard. The answer to your question do you find surprises every day, man? Every day.
Yeah. Well, and I think it's signal and noise, right? So how do you, I don't know, what's your screen for going, that's actually material enough that I'm going to change my path versus, oh, that,
You never do that in a silo. You never do that in a silo. That's why you have a board, in my opinion, right? I know that very early stage you can operate without one. And I know that sometimes founders don't like to have one because of this idea and concept of control. But I think if you get people around the table that all can bring, their input as investors and independence from what they're seeing out in the world, it's very powerful to bring that in. Then you have advisors. I've surrounded myself with really fantastic advisors that I deeply trust, but
mm-hmm.
I don't, there's not one that is the end all be all, that ends up with ultimately with me. And so I take all of the input in and you sleep on it. And then you go with your gut and you go with what the data is showing you. It's a blend of the two. You just do it until you can go back to sleep.
Yeah, exactly. Exactly. Till the anxiety is reduced to some degree.
Sometimes it's when I'm sleepless, it's not anxiety. It's just because I haven't found the golden yes.
Yeah.
Right. And so you just work through it with your both consciousness and your subconsciousness until you get there.
Yeah. Yeah. There's some wisdom there. Um, then Michael has a question about how and why did you select your first molecule for interrogation?
So our first molecule actually came out of part of my doctoral work where, a story for another day, we really were able to map out what I believe to be the Rosetta Stone of decoding the worm language, that had been conserved for hundreds of thousands of years. So I thought that was way too interesting to pass up. And that's, there's also, just evolutionary shots on goal for using that technology and the indications, which we'll announce, in the next coming weeks. We'll be able to share that indication and, future indications for a lead molecule, but also understanding that it made sense. It lined up with the indication that we wanted to pursue.
Yeah. And so that hypothesis pretty much has been your guiding hypothesis for how many years now? Because that's very interesting that like the formation of your PhD work is kind of proven out, you know?
I just don't even keep track of time anymore. Like you said before, like we were just talking this morning, you said you've known me for 3 years. I'm like, really? So just, I don't know.
Yeah.
I've gone down the wormhole. So time is just a vague concept for me.
Yeah. No, I hear you. I hear you. And then you have the COVID years in there too, which is kind of a, yeah,
Yeah.
one of those things. Suds has another question. And this is interesting, because, we invest in things that are human health, planetary health, so deep tech. So all of our founders are people that are basically speaking science. His question is, there are some investors that speak biological science better than others. How'd you navigate that? How'd you maybe choose your syndicate? And I think it's public record because you've had some press around it, but maybe, obviously we're investors. Do you want to comment on who the other investors are and just how you thought about the investor syndicate you built? And
Sure. Well, I guess I'm trying to understand whether you're asking whether for advice for navigating those that do speak biological sciences or don't. And I mean, how did you interpret that question?
I interpret that as that there are some that don't speak it well.
Uh-huh. Well, that's your
Like,
job. That's your job, bro. You gotta be able to, the CEO's job is you're always looking to, you see what's around the corner, and your job for those who have not yet gone there is to walk them through and explain what's around the corner. And that's not with investors, that's going to be also your team and others around you, and eventually the FDA. Your job is always to be able to explain your technology. I always think about Denzel Washington in Philadelphia. He said, explain it to me like I'm a 4-year-old, right? You always have to be able to explain your technology to anybody. And I think that if you are not utilizing that opportunity, you're missing opportunities because there's a lot of wisdom from people that don't speak biological sciences. You have to actually, I think it's better to surround yourself with that diversity. I've always surrounded myself with people that think differently. So it's just part of the job.
yeah, yeah. Is there something that you do, or I mean, it sounds like you maybe employ what you said, the Denzel Washington, you know, philosophy. Is that basically the guiding principle? You just say, hey, you know what, I'm just gonna do it as simply as I can, and then less is more. Maybe is that in certain instances?
It's just pretending you're a storyteller, right? I think ultimately, at the end of the day, if you go back to tribes, that's what we are. We're around the fire telling stories. So I think you always have to practice telling your story and seeing what works and what doesn't work, and then just humbly taking in that feedback,
Yeah.
and then trying to find a different way to tell the story. And you'll see as you tell it different ways, which ways resonate and which ways don't, and then finding people that can help you craft that story. Who's the person that asked this question? Just give me a call.
Uh,
I'll help you tell your story.
yeah. Yeah. That's it. No, that's really interesting. That's something that we talk a lot about with all of our founders is the importance of basically storytelling, building the brand. And I know that's something you actually have spent a lot of time on, on your brand name, even on your brand image, on your, just strategically going after the PR communications and controlling the narrative around your company. Can
For
you?
sure. And there's also shout out to Rob Afocal, who and you introduced me to, did a
Yep.
tremendous amount of work on our brand colors and
Yep.
a lot of thoughtfulness around, the how to present the name, the text, all of the subconscious pieces that go into telling your story. You just have to surround yourself with people that can help you to do that.
Yeah. Yeah. And why did you choose to? Because some companies are a little bit more hesitant to do that early on, but I know that you pretty much since we first met have been thinking about that, asking about that, working on that. Why did you? And I think that's wise, but but why did you do that? Like why was that so important to you early on? What was the rationale
I
there?
think maybe it's just existentially, I always find it important to really own your identity. It's like having a baby, right? Like your idea and your startup is your baby, right? And I think when I had first had my child, who's 4 now, Sebastian, I put him in all of like this like whatever the random newborn blobby onesies, but at some point you see their personality, and now it's just Hot Wheels for life, right? So I then want to curate that so that he feels his greatest expression. And I feel the same way about Holoclara. It's like my child. And could I give it some really bland landing page? Sure. But where's the joy in that? And, I think I really want to own who we are. And I will
Yeah.
really want to own that up front. And also at some point, you need to recruit people to join your team. So
Yeah.
how can you do that? If you build it, they will come. So you need to, and it doesn't even need to be fancy. It just needs to be clear and true to who you are.
Yeah. 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 No, thanks for that. To me, that's a really important point to make, because I think that sometimes people think, oh, I'll get to the brand later. We're building science right now. But if you, it's like if you give up ball control is how I equate it, then people are going to be talking about your brand. And if you're not, then there's a vacuum and you're going to have to eventually wrestle control of it again. Um, so it's best out of the gates to just have ball control and continue to build that brand out, because it helps for business development, recruiting, investors, all that stuff.
Yeah.
Um, so Dalton has a question, another founder. So I'll just read it here. Can gut roundworms at any dose be therapeutics themselves, or do they cause significant disease, AEs in humans? What's the benefit of giving animals the actual worms versus giving them compounds that the worms secrete?
I think that's a great question. I don't know about you, but as much as I honor the worm and their history, I don't want no worms in my body, right? I'm not going to be taking shots of worms in a Gatorade.
Yeah.
No, no, sir. You have no idea what actual worms are going to do for many reasons. One is there for sure can be AEs, for those who don't know, or adverse events. So you think about that worm now creating a bolt, causing bowel obstruction, right? What if the few go rogue and they're start burrowing in your body? So we don't want the worms. We want to, they themselves have created their own set of Jedi tools. We just want those tools to use for our advantage.
Yeah.
We don't want to use the worms. No offense to the worms. I'm grateful, gratitude to the worms, but we don't want to put them back in our bodies because one, also, I cannot be accountable for what happens when we put that worm back in. I don't know enough about human evolution that I can speak for the worms, but I can speak for the molecule. Once we identify it, then we could do our own set of studies to identify and know and map out what that molecule is doing and the pharmacokinetics, the clearance. How long is it in your body? What is the tox profile? When you give a worm too, you can also, how do you even track that? That's a regulatory nightmare. Does it become one worm, 1,000 worms, 0 worms? That dose is completely untrackable, unreliable. So I think that I'm trying to take the mystery out of this. And that's why we are more keen on taking forward therapeutics instead of worms. However, the people that are taking worms, that's fantastic. That's their own decision because they've decided, risk benefit ratio. How long is it going to take for, all of the technologies to get out for all of their diseases? It might not be in the next 3 years, but someone can go get worms right now in Mexico, right? So that's an individual choice. And I actually talked to some of those people, and it's really great to hear their stories.
Yeah. Yeah. Oh, that's interesting. So there are people that have come across this or figured out, or either way, figured this out themselves, and they're going after the problem in their own way, in ways that are, yeah, not the regulatory, kind of, drug path, but they're, yeah, that's
There's
interesting.
you can look at the New York Times article, Parasite Underground, right?
Mm,
It's all about people that are in the shadows, just trying to get these unregulated worms because
yeah.
they're desperate. And
Yeah.
there's great stories out there from people that it's really served them.
Yeah. Yeah. That's really interesting. Um, so Dan has a question, and maybe it's piggybacking off what we were just talking about, actually, which is just, are there competitors in the space? Other people perhaps have started to have a similar insight. Are there others that are trying to do this the same way or analogous ways?
Maybe I haven't seen any worm-derived molecules get into the clinic and move forward. I think that there are those that have tried. I think some of them have tried forward with protein, either the worm itself
Hmm.
right? And there's been really promising data and then can't be replicated. Why can't it be replicated? I don't know, maybe because someone didn't grow the worms the same way before they gave them to people. Who knows? And then there's some that maybe tried with proteins, but you, I don't, none of them have been approved. I think there have been start and stop attempts, but I
Hmm.
think we're the first to really turn this into a discovery engine and say, this is what we're doing and how we're doing it.
Yeah. Yeah. And maybe describe, I'm curious, how would you answer, uh, or how would you describe how you're thinking about your IP portfolio? Just because these worms have been around for millennia, right? Or longer. Like how, how are you approaching your intellectual property?
Yeah, so first, you can't really own a natural compound, but you can own a lot of aspects of it, including the method of using that compound, method of use, and also formulation. You can make changes, chemical changes to that molecule to better improve it. So then you can get composition of matter based on that. You can try to make it more orally available, bioavailable. There are many things that you can do in the chemical space that give you abundant IP opportunity. So, we have really broad IP surrounding our molecules. Otherwise, we wouldn't move forward with them to begin with.
Gotcha. Yeah. Yep. So there's ways to defend yourself, even though this is a publicly available worm, if you will. Yeah.
Yeah, I love
Um,
that. I need a t-shirt, publicly available worm.
I should have worn it today. I still have my daughter loves it too because she has a similar immune condition that I have, but the worms are us hats.
Yeah, that was David Anderson's idea, who's
Yeah.
one of our advisors. And
Yeah, that's great. Um, so Dalton, appreciate the questions, has another question. And I'll just read it for everybody so you don't have to go to the chat. When you think about clinical development, how do you think about keeping your lead and taking it through FDA yourself to own the commercial opportunity versus licensing it out to big pharmas? Where do you see the biggest value capture for Holoclara?
I think everybody, it's the earlier you partner, you have obviously the resources and the support of someone like Big Pharma. But also then you lose a little control over making sure that the right dose is being picked, the right application, all of those elements. So there's a sweet spot. And I think that that answer is just different for everybody. And it's going to be different in our pipeline, molecule to molecule. But I
Mhm.
think that we really want to see this through to proof of concept and get the signal that we need to then explore the right partner and have the most opportunity to have more partners come to our table for partnership. And we've already begun some of those conversations, but like I said, it's just a sweet spot and it's different for every molecule and every company. But those are some of how we've been thinking about those conversations and when is the right time. It's like I said, it's also it's like your child, right? So then when is the right time for, let's say the college comes in early and you have a kid that's playing a sport, they see that, then they want to sponsor them from elementary school versus high school versus, after graduation. Sometimes you want to mature that individual more and further and explore what else can they do. Well, maybe they can play baseball and basketball. Wait a minute, this now opens up other opportunity. So you just want to use that time to explore that. It's different for every child, every molecule.
Yeah. Maybe a follow-on question is just, are you having, because maybe get more specific on where you are in the clinical path, just the regulatory path, where are you at? And then couple that with, are you having discussions with, and you don't have to name names, obviously, but just are you having those types of discussions with pharma right now? Or are you like, you know what, with where we're at, it's not worth my time to invest much time in those discussions today.
I think we've definitely had conversations, but the focus is on the clinic. And what I can share is that we will be going to our first in human trials this year,
Yep.
and you'll be able to see a press release about it soon.
Yeah. Yep. Yep. Gotcha. That's helpful.
All
Yeah, what
right.
we find is with companies that can be, I mean, this word, it can be, one that has a lot of different connotations, but for companies that that could be platforms, that it's advisable to drive all the way through as far as they can. There's obviously discussions along the way, but prove it out with a real asset. Because people don't value platforms, they value what that platform is able to deliver. So, I know that yours is, you're focused on delivering that first asset, but this could actually be used for multiple different applications. So,
Yeah, for sure. It's a blend of who we are because we do want to nurture the technology and the discovery platform and show, proof of concept. But also it's a reflection of us appreciating the market. There are a lot of companies that have promised and didn't deliver. So investors are really looking for clinical data, and I don't blame them. So I think it's responding to what's happening out there and also capturing our own motivation. It's a blend. It's hard. I feel like I'm not giving any answers that are very black and white, but the truth is, as a CEO, you do have to live in the gray zone day to day almost.
yeah, yeah, awesome. I will do a last call here. If anyone else has questions, please put them in there. Um, but if not, just want to say thank you for taking the time. I don't have any other questions right now. I think you've done a really good job in just explaining where you're at, how you got here, and really excited about the work that you guys are doing.
Thanks.
So unless anyone else has any more questions, I will conclude this for the day and look forward to speaking with you again soon.
Thanks. Thank you for investing in us and thank you for hosting this. It was a pleasure and hope everyone has a great day.
All right. Yeah. Thanks so much. Have a good day, everybody.